Hello everyone, my name is Dr. Scott Thompson. I am a doctor of occupational therapy and the director of clinical services here at Saebo. Today I'm going to be showing you the best stroke recovery hand exercises, stage 1. Stage 1 exercises are for people who have just begun to be able to do movements with their hand, wrist, and forearm. But you still need to be using your unaffected limb to complete movements or help it along. You could be anywhere in your recovery. It could be where you see just a little muscle twitch all the way up to you can do, let's say 75-80% of the movement, but you're still using your unaffected limb to assist in some way. The first exercise I want to show you is moving your wrist side to side. You want to start with your hand facing down on the table, and you want to move it side to side. But of course, you're going to be using your unaffected hand to help it move. The big thing that I want to teach you is that you need to work on finding how much assistance you can give while still doing movement with your affected limb. A lot of people like to do the movement 100%. They like to just pick their hand up and do this. Well, you complete the movement, that's great, but the issue is that you haven't worked or challenged the unaffected limb. That's the one that needs the most work. So what I want to encourage you to do is practice all of these exercises by giving enough, just enough assistance with your unaffected limb, but still doing the movement all the way through the entire range of motion. See how well you can do. Because the more that you do, the better your results can be. All right, so wrist side to side. We're going to go out, contract, keep moving, keep moving, keep moving, and to the other side. Now you might be able to hear that my palm is sticking to the table. So one of the things I like to do is use a washcloth, and whether your hand is in a fist or it's open, you can try to use the washcloth. It's not going to work for everyone. Sometimes you lose focus of what you're doing and focus more about trying to keep your hand on the washcloth. If it's distracting you or if it's not working, just get rid of it. But it is a technique to help you move a little bit easier across the surface. So you can put it on the washcloth and then move to your side and then move to the other side. And again, I might be moving faster or slower than you can. But make sure that you're challenging yourself and making that affected limb work the entire time. Okay, next we want to work on wrist going up and down. So we have a couple options. One, I'm going to do it again on this washcloth because it's easier to do. You want to have your hand sort of in what we call a neutral position or sort of with a thumbs up position. You're going to help move your wrist up and then move it down. And up and back down. And up and back down. You can also do this if you have the ability by clasping your fingers together. That helps you push and pull your wrist. If you want to make it a little more difficult, you can elevate your wrist, probably not on a washcloth, but maybe a rolled towel. You can elevate your wrist and then go down. Help it up. And help it up. Up. And flip it over and up. 2 and 3. To give even more range of motion, you can actually drop your wrist off the edge of a table so that you have full range of motion. And that'll give you the best exercise or the most difficulty when you're doing these exercises. Next, I want to work on turning our hand over. Most of you will probably start with your hand flat on the table or in sort of a neutral position with your thumb towards the ceiling. That's totally fine. We just want to make sure that when we're doing this exercise and assisting with our unaffected limb, not only are you giving just the right amount of assistance where your affected limb is still doing some of the work, but you also want to be making sure that you're not injuring or torquing or twisting your wrist, because that can cause permanent damage. So, over. And help it back up. And then we want to go over. Giving maybe a little bit of pressure up on the forearm to help rotate the forearm or get your hand down. Again, if you can't put your hand flat on the table, do not worry about that. You'll eventually get those muscles stretched out so you can do that. You don't want to force any of these exercises because it's going to increase your spasticity. If your spasticity increases, stop, relax, reposition yourself, and start again. This exercise is opening and closing your hand. I'm going to demonstrate it on a washcloth, but again, you do not have to use the washcloth. You can do it without on a table. And what I'm doing is I'm actually applying a little bit of pressure on my fingertips with my other fingers, trying to help curl, and then guiding them in. And again, you don't have to have a super tight fist. You don't want to do this super fast because that's going to increase your spasticity. And then you're going to want to put your thumb out and get your fingers to extend. Sometimes you can also use the washcloth to help extend your fingers. One last thing that you could do to really challenge yourself is actually do endurance training for your muscles. And by doing that, you will do one repetition of every one of the exercises in every direction, and that'll count as one set. So to show you, it would look something like this. I'm going to do it on the washcloth just because it causes less friction. But remember, you don't have to do it on a washcloth. So you would do side to side, followed by wrist up and down, followed by turning your hand over, followed by opening and closing your hand. And that's one set. And I would suggest challenging yourself to do 2 sets, maybe 3 sets, maybe 4 sets. Thank you for joining me today. I hope you've enjoyed these exercises, and I look forward to seeing you next time. Because with Saebo, there is no plateau in sight.